Medicare. Health care for the aged, the disabled, and those with chronic renal disease. Medicaid. Medical assistance for needy Americans of all ages. Clinical Laboratory Improvement Program. Safe and accurate laboratory testing. State Children's Health Insurance Program. Health insurance for millions of uninsured children.
Welcome to CMS You. I am your host, Norma Harris. Each month we bring you up-to-date information from the Centers for Medicare and Medicaid Services. CMS is the federal agency that administers Medicare and oversees Medicaid and the Children's Health Insurance Program. Part of the national conversation about access to quality health care includes segments of our population who are not eligible for Medicare, Medicaid, or even to purchase insurance on the marketplace. Today, with my guest, Cheryl Donald from Health Resources and Services Administration, better known as HRSA, we'll discuss options for those often referred to as uninsurable. HRSA funds health centers in high-need communities across the nation to improve access to health care by providing comprehensive, culturally competent, quality primary health care services to the medically underserved communities as well as to vulnerable populations. An example of their impact is reflected in the number of people they serve. For example, in 2012, the 1,198 sites that received HRSA grants served 21,102,391 people. Among them, the homeless, migrant workers, the uninsured, veterans, and children. Some statistics for you. The New York program has 57 grantees. The total number of patients that they served in 2012 was 1.5 million. The New Jersey program has 20 grantees, and in 2012, they served almost 500,000 people. First, let me welcome you, Cheryl. Thank you for being with us.
Thank you, Norma.
And tell us exactly, what is a federally qualified health center?
A federally qualified health center is a health center that receives federal funding to provide health care services to the community. For the purposes of our conversation, HRSA-funded programs are funded by the Public Health Service Act, Section 330, and that funds our community health center program.
Okay, now, so many people are uninsured, and because of that, they really don't have a regular relationship with a doctor. How does the federally qualified health clinic help this?
Well, community health centers are actually located in your community, and they are providing primary care services. So what that allows is relationship building between patients and their providers. It gives them a medical home, so to speak, a place where they can go and receive their care. They know what the hours are, they can expect what the fee structure will be, and they are recognized by their doctors and their providers.
Is this different from all of those little walk-in clinics we see popping up around the place?
Absolutely. So like I said before, community health centers are considered medical homes. So versus an urgent care center or something like that you've seen popping up in the community, they provide urgent care. However, our community health centers provide a full range of primary care. In addition to that, they also provide support services and program management and case management services, as well as ancillary services such as diagnostic treatment services, as well as mental health services, dental, oral health, things along those lines.
So who generally do they serve in our communities?
So our community health centers that are funded by the Health Center program are actually located in medically underserved areas, and they focus in on medically underserved populations, and the legislation appropriates funding for migrant and seasonal farm worker populations, as well as homeless populations and residents of public housing.
Well, I'm glad you mentioned even the migrant populations, because often we forget that even living among us are people who are migrant workers, so that is important. Now tell me, how long have they been around?
The Community Health Center program has been around for over 45 years. And in that time, we now are servicing approximately, and I believe you mentioned this before, 1,200 sites. And those 1,200 sites actually manage, well, those 1,200 grantees, I should say, actually manage over 9,000 sites across the country, to include all 50 states as well as our territories, so Puerto Rico, the U.S. Virgin Island, as well as the Pacific Basin.
Oh, okay. And so what role do you think that they'll be playing now in this expanded healthcare arena that we're looking at?
Well, we're talking about the Affordable Care Act, and the Affordable Care Act actually established the Community Health Center Fund, which provides over $11 billion over 5 years for community health center expansion and operation. So $9.5 billion of that money has been targeted for ongoing health center support services, as well as creating new health center sites to extend medically underserved sites, okay? And also to expand primary care services as well. So those funds are really geared at anticipating the additional users that will come in as a result of the marketplace and the new people that are enrolling in health insurance.
So this is all the new funding, which will not really put the health centers in a bind because of all of the information that's being given out now, because as I am thinking, I'm hearing more about the federally qualified health clinics now than I ever did before.
Absolutely,
Yes.
absolutely.
So how can somebody find them?
Well, our health centers can be found easily through our online website. So if you visit www.hrsa.gov, on our homepage you will see a widget on there that says Find Your Health Center. You just need to input your zip code and your health center will pop up. Multiple health centers in your area will actually pop up.
Well, that's good because I didn't know of any before. And so now you're telling us that they're really in our communities.
Absolutely. And our community health centers are actually community health centers. They're integrated into the community. Some people may actually already be using them and not realizing that they're federally funded community health centers. And the purpose of that is very specific in the legislation. So our health centers are governed by user majority boards. So the patients are actually contributing to the oversight and management of these community health centers.
That is interesting. Then they become more responsive to the community needs.
Absolutely, and the needs of the patient, absolutely.
As well, yeah. And what services do they help pay for? You mentioned a few in passing, but can you give us a little bit more detail about what they do?
So the primary and preventive services that our community health centers provide include family medicine as well as internal medicine. In addition to that, gynecological services, obstetric services, and then also depending on the health center and the location and the needs of the community, they also provide mental health services as well as oral health, dental services, and also provide referrals for specialist services if those are things that are needed. In terms of preventive programs around wellness programs, around diabetes, hypertension, programs such as that are specific toward the needs of the community are also available at the community health centers.
Well, that's good to know because we do know that more people than ever are now experiencing issues as a result of diabetes and hypertension, have end-stage renal disease. So that's a battle we have to continue fighting.
Absolutely.
About eligibility, who can go to a clinic? Who's eligible to participate at the clinic or to get services?
Absolutely. Everyone is eligible to come to a community health center. Health centers, because they are federally funded, are there to provide care to everyone regardless of their ability to pay. So whether you have private health insurance or if you have public health insurance or if you have no insurance, you cannot be turned away for any reason.
Does someone's immigrant status have anything to do with services?
Our services are available to anyone, so no one will be turned away at our community health centers.
Because some of the populations we deal with in central areas like Brooklyn and Queens are often a little, I'll say, gun-shy about going to these places because of being asked for identification papers and immigrant statuses and things like that. Now tell me, why do I need insurance then if you're around?
Okay, that's a great question. The reason why we all need health insurance is because the cost of care is expensive. And so even though our community health centers will base the fee on what you're able to pay, overall, having health insurance actually facilitates an overall access to care that really encourages us to take care of ourselves in more of a preventive, proactive fashion versus a reactive fashion. And so the health center helps ease the burden of cost on us as patients, as well as on the providers, i.e. the health centers that provide the care.
So why shouldn't I just go to the emergency room when I feel like?
So in terms of the emergency room, it's very interesting because emergency rooms are designed for emergency care. And when we use them for our normal primary care, not only is it an inconvenience for us because we are often waiting in the ERs for a very long time, but they also become an expensive way to get care. And often we're just treating the problem and we're not working toward preventing the problem. And so having a relationship with a provider, someone who actually knows your name and may know your history and your medical history, and when things come up, to be able to go to a health center is a much more pleasant process than to sit in an ER for hours on end for a non-emergent problem.
Well, you answered my next question, which was how's a federally qualified center a better choice than an emergency room? Again,
Absolutely.
the relationship between the patient and the provider. And how does one get to go to a federally qualified clinic? Do I have to make an appointment, or do you have walk-ins? How does it work?
So it works in various ways. Ideally, you would call the clinic, and again, you can go to our website and they will have access to the phone numbers to contact the clinics. Many of the clinics actually have websites, so you can take a look and see what the services are that they provide. You give them a call and schedule an appointment. Some of our health centers actually have what we call open access, which means that they can walk in and you don't have to make an appointment, so you might want to follow up with the health center and see if that's an option for you as well. And then once you make your appointment, if you don't have insurance, the health center has what we call facilitated enrollers that will help find out if you qualify for any of these health insurance programs, if you are uninsured, and if you are qualified for some of them, i.e. the Medicaid program, Medicare, Children's Health Insurance Program, etc., then they will help get you enrolled in those programs and covered.
And how do they keep their records, or are they able to interchange records? I've been going to a doctor, now I go to a federally qualified clinic. I mean, how do they exchange information?
So as part of the Affordable Care Act, there has been funding allocated to help build the health information technology capacity of our community health centers. And so many of our community health centers have electronic health records, and some have electronic medical records. There's a little bit difference between the two. But basically what they allow is for electronic management of health records so that providers can talk to each other and have access more quickly. It's a more efficient way to manage healthcare, as well as have different providers who, many of the patients in health centers have multiple needs that need to be addressed. So they may have an oral health issue, and they may have a physical health issue, as well as a mental health issue. And having that electronic health record allows all the providers to speak together and be on one accord when treating a patient.
Well, that is good, because one of my colleagues always likes to say about health records, everybody has them but the people who need them, which are your physicians.
Right.
Because the insurance companies have them, and the payment people have them, but the doctors don't have your information. You serve so many of the uninsured and the underinsured. Patients coming into you, will they be able to get help in getting insurance also?
Absolutely. So as the marketplace has already started, as we're well aware, in addition to the facilitated enrollers that we already have in our health centers, we also have what are called certified application counselors. The certified application counselors actually are designed to help assist enroll people into the marketplace. And so that is part of the new Affordable Care Act with the healthcare reform piece and getting people enrolled in and covered in services. So the certified application counselors will help you through that process. So many people who have been uninsured for a long time may not be familiar with the language, may not know what a copay is, may not be familiar with what a deductible is. And so our certified application counselors help you through that process, all the way up to choosing a plan and actually enrolling in a plan. So they are available not only for health center patients, but people that are in the community around as well. So if you don't utilize the health center but know that there's one there and have questions about enrolling in the marketplace, the certified application counselors are there to assist.
I just want to let our viewers know that they may not be the only ones who don't know what copay or coinsurance is. We were at a hospital recently, and one of the people who's in outreach or education or promotion or something, we asked the question, what's a copay, what's a coinsurance, what is the difference? She didn't know.
Right.
So don't be embarrassed if you don't know the insurance lingo, because there are people here to help you with it.
Absolutely.
Now, what about children who need to get health care? Can they come to you also?
Absolutely. The community health centers serve all ages across the entire lifespan. So we have a geriatric population as well as a child population. And again, our facilitated enrollers help ensure to make sure that children who are eligible for the Children's Health Insurance Program are actually enrolled. Children who are eligible for the Medicaid program are actually enrolled. And so we do welcome children, we welcome their parents, we welcome their grandparents, we welcome the entire family at the community health centers. And we hope that our patients view the community health centers as their medical home.
That's wonderful. Now, how does the center make a determination as to what people pay?
Okay. So all of our health centers have established what is called a sliding fee scale. That sliding fee scale is based on the income of the patients. So the first thing that the health center is going to do is find out if they qualify for any of these insurance programs. So if you qualify for any of the public programs, the health centers will help get you enrolled. If you still are not eligible for those programs, and you also are not eligible for the new insurance programs through the marketplace, then you would be eligible for a sliding fee scale at our health centers. And that would be determined based on an interview with the health center staff and based on the information that patients are have available to them to present to the health center around income and revenue along those lines. Their fee will be based on that.
Well, a lot of our uninsured and underinsured people may not get a paycheck. How do we go about it? Is that self-attestation, or we're not living in a very trusting world nowadays, and everybody tells you they're going to lie to you, but I don't know that they might. But how do you determine that?
In instances where someone does not receive a formal pay stub, often that's taken on a case-by-case basis. And so the health center will work with that individual. Perhaps the person who provides them money would be willing to write a letter just indicating how much they give them on a regular basis, or they just may have to personally attest to what's coming through in terms of income. So there are various ways to do that, but it would be on a case-by-case basis.
And you will help them regardless of their legal status?
Absolutely. So again, no one is turned away at our health centers.
Now, are there any other resources for people who are undocumented, for example, to get health care if they need it?
Absolutely. So for those who are undocumented or those who are not quite sure where to go for health care, I invite them to visit our website, again, www.hrsa.gov/gethealthcare. That website will give you an idea of the programs that are providing direct health care to Americans that are funded by HRSA. Also at that link, you will also find links to other affordable health care programs that are offered by different federal agencies. And so that's a great resource.
Well, I don't want to put off anybody who doesn't have a computer. If you don't have one, just go to your public library.
Absolutely.
And ask somebody to help you get onto the HRSA.gov website.
Right.
Now, most of our people who are underinsured or don't have insurance have the greatest health needs. Why would they go to a federally qualified clinic to seek help?
Okay. Well, one of the things that we have found through our research of clinical data that comes out of our community health centers, again, like I mentioned, we have 1,200 grantees in over 9,000 sites. We found that the primary care is as well or even better than some of the primary care that you will receive elsewhere. So we're very proud of the clinical outcomes of our community health centers. The fact that our patient population has outcomes around health disparities that have been reduced in comparison to people in the community who may not be health center patients. In addition to that, the funding that has gone into building the infrastructure of our community health centers, and the fact that a lot of the money that's coming through with the health center fund that's coming out of the Affordable Care Act also is going toward building the infrastructure so that the health centers can be prepared for the additional patients that we expect to come through.
And they will be there, trust me on that. I've seen some of these health centers, by the way, and some of them are in excellent condition. They're quite
Absolutely.
inviting. I didn't know they were federally qualified health centers
Right.
now. I thought they were private clinics.
And the interesting thing about that, and I'm glad you mentioned that, is because a lot of people don't realize that the federal money is supporting these health centers. But in addition to that, our health centers are not just serving the uninsured and the underinsured. We also are serving people with private health insurance because they are the ideal go-to place.
Well, that is key only because I know you provide dental service, which a lot of insurances don't.
Right.
Tell us a little bit about that.
So we do provide in many of our community health center oral health services on site. And so that is a great one-stop shop for people where they can see their doctor as well as go and see their dentist and get their teeth cleaned and any other work that needs to be done. And so it's really attractive to people. And to know that it's located in their community is also helpful.
Well, we've talked about the health clinics, but we haven't talked about your agency. Tell us a little bit about HRSA.
Okay. Well, the Health Resources and Services Administration is actually a sister agency of CMS, and we are part of the U.S. Department of Health and Human Services. And our primary mission is to provide health services and access to health services for the uninsured and the underinsured and what we consider vulnerable populations. So through our programs such as the Community Health Center program, programs such as the Ryan White HIV primary care programs, as well as our maternal and child health programs, organ donation programs, et cetera, et cetera. HRSA is there to serve the vulnerable populations. And so I invite everyone to visit our website at www.hrsa.gov to learn a lot more about our agency, and I guarantee that you all will be very familiar with our programs and may not have realized that they were funded by HRSA.
There's another program I would like you to talk about, and that is what is called Workforce.
Okay, absolutely. How could I forget that, right? So we have all of these patients that are coming into our health center, and how are we going to make sure we have enough providers to service them? And so one of our programs is called the National Health Service Corps. And the National Health Service Corps has actually received additional money through the Recovery Act as well as through healthcare reform to actually build up our cadre of what we call core members. And these are healthcare professionals who actually either receive loan repayment and or scholarships for agreeing to work in underserved areas. And these underserved areas can either be urban areas or rural areas.
I'm glad you mentioned that because everybody thinks that the underserved areas are in some distant place, and they fail to realize that they're right here in big New York City and in Newark and some of our larger cities as we see them. Now, people have insurance, and we know they're more than likely to go see a good doctor. But what are you what are you doing now to promote your agency to make sure that people know more about these health clinics?
Absolutely. And so with our community health center, we're really pulling on our primary care associations, which really work at marketing the community health centers and letting those services known. And then also the community health centers themselves have outreach workers that actually go out into the community and educate people of their existence and invite them to come in. So again, we, through activities like this, we're really trying to educate the public on our Community Health Center program and encourage you to research it. If you have an iPhone or an Android phone, there's an app for that, and you can download the Find Your Health Center app directly to your phone, and you can put in all of your information, and you can find a health center while you're on the go. And so we're really trying to make the information more accessible.
Wonderful. Cheryl, thank you so much for being with us today.
Thank you for having me.
Thank you for giving us so much information. Everyone is talking about the marketplace, the website, and enrolling in a plan. For those who are ineligible for Medicare, Medicaid, and other insurances, remember there is help for you. Even if you are eligible for coverage, but you haven't signed up yet, you don't have to wait to get affordable care from your local federally qualified health center. To locate your closest community clinic, call your local information or log on to www.hrsa.gov and input your zip code. The response will include the name, address, and phone number of your nearest clinic, including times. To veterans and transitioning service members, working at a health center may work for your career. Health centers need staff with a wide variety of skills and experience in a range of positions. We hope you've learned something new today. Thank you for joining us, and thank you for watching CMS and You.
How to pick the right health insurance plan. How do you find a health insurance plan that fits your budget and meets your needs? A good plan protects you and your family at a price that's right for you. You can feel safe knowing that all marketplace plans cover a core set of essential health benefits, like checkups, having a baby, emergency care, prescription drugs, and more. Most marketplace plans must also include free preventive care, like shots and screening tests. And don't worry if you have a pre-existing condition. You'll see the same plans at the same cost as everyone else. You can't be denied coverage. Here are a few things to think about before you look at health insurance plans. Health insurance is a contract between you and your insurance company. You buy a plan, and the company agrees to pay part of your medical costs when you get sick or hurt. Although plans in the marketplace cover a core set of essential benefits, the amount you'll pay for those benefits will be different from plan to plan. When you buy insurance through the marketplace, you'll generally make a payment each month called a monthly premium. There will be lots of plans available to you, some with low monthly premiums, some with high monthly premiums. In general, if your monthly premium payments are low, the cost of getting care, or how much you'll pay out of your own pocket for things like prescriptions or hospital stays, will be higher. And if you pay more each month for your premium, those other costs will be lower. Finding a good health plan means balancing how much you pay for your premium with how much health care you think you and your family are going to need during the year. If you're healthy and don't go to the doctor very often, then a plan with a low monthly premium will probably cost you the least. But if you do need to go to the doctor a lot, or you need a lot of expensive prescriptions, you should look at plans where the cost of getting care, or how much you'll pay out of your own pocket, will be lower. If you really need a lot of health care, spending a bit more on your monthly premiums will actually save you money in the long run.
Now I'm covered.
Now for the first time, you can be covered with a quality health plan from the new Health Insurance Marketplace, part of the healthcare law. It's where brand name companies offer plans you can compare side by side, and it's the only place to get lower monthly payments.
I'm covered.
So if you have an accident, get sick, or just need a checkup,
I'm covered.
We're covered.
Now we're covered.
Enroll now at the Health Insurance Marketplace at healthcare.gov.